UNICEF. The acronym UNICEF stands for United Nations International Children's Emergency Fund. This organization was created by the United Nations in 1946 to provide emergency help to children in post-war Europe and China. In 1950, UNICEF's responsibilities were expanded to providing long-term help to children and mothers in all developing countries. 3 years later, UNICEF became a permanent part of the United Nations system, and its name was changed to United Nations Children's Fund. Despite the name change, the acronym UNICEF was kept, and today most people know of the organization by its acronym rather than its name. UNICEF works with the governments of individual countries to provide 3 kinds of services. It plans and develops programs, trains people to work in these programs, and provides the supplies and equipment to help the programs function. The programs that UNICEF develops cover 5 main areas: immunization, education for girls, child protection, early childhood development, and HIV/AIDS. In the area of immunization, UNICEF has had many successes, but it still has much work to do. Among its successes are the eradication of smallpox, the near eradication of polio, and a sharp decrease in the numbers of deaths from measles and tetanus. However, there are still countries that do not provide routine immunization, and in these countries, diseases such as measles, diphtheria, whooping cough, tuberculosis, and tetanus persist. According to UNICEF, more than 2 million children die each year from diseases that could have been prevented by inexpensive vaccines. A second goal of UNICEF is giving children the best possible start in life. In fact, more than half of UNICEF's budget is used to help children in their first years of life by providing them with better health care, nutrition, water, sanitation, and education. But the needs of young children around the world are overwhelming. According to UNICEF, out of 100 children born in a year, 30 will most likely suffer from malnutrition in their first 5 years of life, 26 will not be immunized against the basic childhood diseases, 19 will lack access to safe drinking water and 40 to adequate sanitation, and 17 will never go to school. Each year, these problems cause the death of 11 million children under the age of 5. That means each day 30,000 children die, and most of these deaths could be prevented. One of the biggest challenges facing UNICEF today is HIV/AIDS. Globally, there are now 42 million people with HIV/AIDS. More than 3 million of them are children under the age of 15, and 12 million are young people between the ages of 15 and 24. One of the primary reasons for the increase in the number of HIV/AIDS cases is ignorance about how the disease is spread. Surveys done in 60 countries have revealed that the majority of young people do not understand how HIV/AIDS is transmitted from one person to another. To change this, UNICEF focuses much of its attention on educating young people about the disease. In addition to its educational programs, UNICEF is also involved in taking care of people with the disease and protecting them from discrimination. While much of UNICEF's work is now in long-term projects, it still plays a vital role in emergency situations. In cases of natural disasters, such as floods and earthquakes, UNICEF is able to respond quickly to people's needs, especially the needs of children. For example, when monsoon rains caused rivers in Bangladesh to flood in 2004, millions of people were severely affected. The floods contaminated drinking water supplies, quickly spreading disease. UNICEF was able to move in quickly with medical supplies and equipment to set up sanitation systems. The organization's rapid response to disaster prevented the deaths of many children. Again, when a tsunami hit countries in Southeast Asia in 2004, UNICEF was able to rush relief assistance to the area to help the survivors. In addition to providing safe drinking water in order to prevent the spread of disease, UNICEF was involved in helping thousands of children who were separated from or lost their parents when the tsunami hit, as well as many more who were traumatized by the event. How does UNICEF pay for all this? 3/4 of the organization's money comes from the contributions 85 of governments. The remaining 1/4 comes from individual contributions, the sale of UNICEF's greeting cards and products, and special events held to collect money for the organization. For example, in 2004, a chef in London decided he had to do something to help the 90 victims of the tsunami. He organized an event called UNICEF, in which more than 150 restaurants joined together to raise money for UNICEF's Tsunami Children's Emergency Appeal. Restaurants participating in the UNICEF event donated a large part of their earnings. With the help of people and organizations like that, UNICEF will be able to continue helping children around the world.